Hello and welcome to the Freedom from Religion Foundation's Ask an Atheist. I'm Annie Laurie Gaylor, co-president of the Freedom from Religion Foundation. Today we're talking about how the GOP's latest budget reconciliation bill, also known as Trump's Big Beautiful Bill, is threatening access to reproductive health care. Joining me from Washington, D.C. is Matt Dan, our Governmental Affairs Director. Hello, Mark.
Hey, great to be here, Annie Laurie. Thanks for having me.
And we have in studio with us Nicole, Safar, and Stephen. I'm sorry, the teleprompter's not working.
Stephen Webb. I am the Vice President here, Public Affairs, here in Wisconsin today. I'm in the great city of Milwaukee.
And thank you again for joining us. And can you tell us what would the reconciliation bill by the GOP do to your patients?
This reconciliation bill has language in it which would prohibit people who are enrolled in Medicaid, because just as a reminder for your viewers that Medicaid is an insurance program and people are who are eligible enroll in it, and it is their insurance just like any other sort of insurance. So the bill would prohibit those folks who are enrolled in Medicaid from going to Planned Parenthood as their provider. In Wisconsin, Planned Parenthood serves about 50,000 patients, and around a little over 60% of those have Medicaid as their form of insurance. So that, 60 to 70% of the patients using Planned Parenthood in Wisconsin would be unable to get their care at Planned Parenthood if this bill goes through. And the really big problem with that is that they don't have anywhere else to go. There are not other providers ready to take these patients in.
The thing is that it just builds a unnecessary anxiety for folks that they have to, go through. We already have numerous health things that we are really trying to address here in Wisconsin, as far as health equity and just access to healthcare. And so this is just another barrier that makes it even more challenging for, a vulnerable community that really needs this and a lot more.
There are 21 health centers across Wisconsin, and really this bill, if it passes, puts all of them at risk because, as a healthcare provider, if over 60% of our revenue is coming from the Medicaid program, that is really an insurmountable gap to fill with philanthropy or other things, especially, in very short term. So, we don't know exactly what that would look like, but it would be a significant portion of access points would no longer be there.
So this would be a healthcare disaster. So politicians also often claim this is about abortion, but I do think we need to emphasize that currently no federal funding goes to abortion care. What's in the reconciliation bill is saying that if people getting Medicaid reimbursement also provide abortion, they're ineligible to continue getting that reimbursement. Is that right? That
is right. And this strategy by the right wing to separate abortion services from the rest of reproductive health care is not new. It's something that they have been using for a long time. It's a policy that was put into place under Governor Scott Walker in Wisconsin, and he applied that policy to state family planning funding. So in 2012, Planned Parenthood was defunded from the state program because of this very reason and had to close health centers. We've seen it happen under other federal programs, and now this strategy is being used to target Medicaid funding.
Clearly, from what you just said with what happened in 2012, plus since the Dobbs decision, abortion care in Wisconsin just got put through the buzzsaw after just Dobbs, it became illegal. Then the Supreme Court, thanks to the election of Judge Protasiewicz, abortion became legal in Wisconsin. And if the reconciliation bill goes through, abortion in Wisconsin would almost have a de facto ban. Can you tell us about a patient or someone that someone on your team had to turn away when abortion was temporarily illegal in Wisconsin, and what would be the further implications of that with the bill?
So after the Dobbs decision came down, Wisconsin has a 1849 law on the books that had been read to make abortion illegal in the state. So when Dobbs went into effect, people in Wisconsin were really uncertain about whether this law would get enforced or not against providers of abortion care. The Attorney General went to court to ask the court to clarify and to make it clear to everyone that the 1849 ban did not apply in Wisconsin. But during that litigation, it took about a year to get clarity from the court. And during that time, Planned Parenthood of Wisconsin was unable to offer abortion care. So it was a really challenging time for our state, and it continues to be a challenging time for the over half of the states where abortion access is not currently accessible or legal.
Yeah, it was scary. The thing is that for a lot of folks outside of Madison, Milwaukee, when we talk about like rural Wisconsin, access was already like hard enough as far as being able to get that care. But what happened was that it became like a really big scramble of like, how do we do it? And really just like really understanding. So one of the big things about that pause was a lot of folks were just unsure about the criminalization part of it. We didn't know really what that meant. And so we paused and we really worked with coalition partners, Iowa, neighboring states, Illinois, to really find a way how we could, give people that access that they needed, during these like very, very uncertain times. But it was most definitely like a really big shift in the way how we had to engage and really provide the services that we needed.
Yeah, it was a terrible time, and it makes us so aware of how terrible it is. And as you say, there's almost 21 or 22 states with either bans or very severe restrictions. And almost half our states.
And I think we're still learning what the public health and maternal and child impact of that lack of access is. There has been research done in Wisconsin by researchers at the University of Wisconsin and in a program called CORE that have shown really the detrimental health impact on women in our state. And in our state, we already have incredibly terrible numbers for maternal and child health.
Especially for Black women. Yes. It's a real shame. It's a stain on our state.
And Steve really leads one of the programs that works on health equity. I don't know, Steve, if you want to share some of that work?
Yeah, most definitely. And so, there's always like a silver lining. So when things happen, there are moments of opportunity that we can improve and be a lot better. And so that's what we really tried to do. And so we came up with like telemedicine just to be able to reach people that really didn't have, access to transportation. We also have a quick program where folks can sign up for a family planning, and then they can get their quarterly contraceptive mailed to them. And so this really just making it a lot easier for people to get the things that they need, so they can continue with all the other chaotic things that they have to endure.
So what would you say to someone who says hypothetically that, if Planned Parenthood closes down, this doesn't really impact my health care because I go someplace else or something along those lines? What would you say to that person?
Or they don't need contraception.
Right.
Yeah. What would they say? Well, the good thing about Planned Parenthood is that we have a whole host, and so you might not necessarily need that, but we have like wellness checks, and the thing is that we make sure that people get all the things that they need. And so this is a service that we don't have that is outside of the scope that we provide. We refer folks to other coalition partners that can be able to serve them as far as the care that they need.
So isn't it right, Planned Parenthood does things like checking blood pressure, for example, STD testing?
Yes, there is the full range of like reproductive preventative care. We do wellness checks for men and women and non-binary folks. We do a lot of education around sexual and reproductive health for the lifespan. So and as Steve said, Planned Parenthood really is a community connection point. We refer to other healthcare providers if someone needs like diabetes care or something that Planned Parenthood doesn't provide. And I think one thing that is also really important about this reconciliation bill and how most Americans feel is that we don't need less healthcare options in this country.
Yes.
We need more healthcare
Yes.
options. And if Planned Parenthood is defunded and health centers in Wisconsin and across the country close, those patients are still going to need healthcare. And where are they going to go? They're going to go to emergency rooms and urgent cares, which are already full and do not have the full capacity to serve their populations. We need more healthcare options in this country, and this bill is going in the exact opposite direction. I think that most of us want to see the healthcare industry go.
That's right, especially in rural areas.
Yeah, we were just talking this week about our health center in Eau Claire, Wisconsin, which is in the northwestern part of the state, where there were some health systems closing over the last couple of years, smaller rural hospitals and like the surrounding clinics. And when that happened in this community, Planned Parenthood stepped into the gap. We increased our hours. We increased our telehealth presence and marketing so people knew they could come to us. And by this point, let's see, where are we? June of 2025, we have already seen more patients at that health center in 6 months than we saw in all of fiscal year 2024.
Wow. So the great need.
So there's a need, and we've been able to step into the gap in places, but who will step into the gap when Planned Parenthood isn't there?
And I mean, theoretically, if the reconciliation bill defunding Planned Parenthood would mean that people who can afford to pay Planned Parenthood, theoretically could still get the services. It's cutting off the lower income. But of course, if you can't maintain your operations at all, nobody will get that.
That's right.
And also kind of from what you said, just at the same time, there's a lot in the GOP reconciliation bill. So there are substantial cuts to Medicaid, plus at the same time, it's the blocking of funds to Planned Parenthood. So you talked a lot about Eau Claire and things along those lines. So it sounds like, particularly in rural areas, that could be a very big perfect storm that could arise from this bill.
Yes, I mean, I think we know in states like Wisconsin and a large portion of our country, it has many rural areas that there is not enough healthcare, there is not enough primary care, there is not enough OBGYN care. People are driving 60, 70, 80 miles to have their babies. There are not enough long-term care facilities, and we really need leaders both here in Wisconsin and in our federal government who can understand the reality for the people living here who need access to more health care. This bill it's devastating for Planned Parenthood, but it is a dangerous bill for all of us who are trying to stay healthy in America.
And what role do you think religious ideology is playing in shaping the GOP reconciliation bill? And why should everyone, religious or not, be worried about that influence if you see it that way?
Religion has always been one of those things that is like easily to be decisive, thing where it's them versus others. That they're different, and that their belief. People's belief doesn't necessarily equate to, what is universally good. And so just really trying to keep things in a space of like value around like human dignity, as far as like, just understanding that these are like civil liberties, these are like social justice things, and not necessarily a religious thing. It has components of it. But like a lot of times in religion, people pick and choose which things that they want to highlight, which things they want to demonize, and so just trying to talk about everything in values.
They are using religious ideology to divide us and to other certain groups of people, And it is just an old trick from their playbook, right? The right wing has been relying on using religious extremism, and it's not the vast majority at all of people of faith in this country, but they are using it to really embolden their political power and divide the rest of us.
And I think it's a perfect illustration of this, that we saw assassinations of people in Minnesota, Democrats, by an anti-abortion fanatic, somebody who's affiliated with extremist Christianity. And we're told that Planned Parenthood clinics were on the hit list. And can I ask, did you get any information about whether these were involving Wisconsin clinics too?
We were in touch with both our national safety and security people and local law enforcement, and we did not see any documentation on that. But it certainly, our hearts and go out to our colleagues in Minnesota and the leaders there. The rise in political violence over the last 10 years has been incredibly troubling, and I do think an extreme ideology that weaponizes religion has played a big role in that.
And of course, Trump has said that he's not going to enforce a federal law to protect abortion clinics, some of the federal laws that were put in place maybe by Clinton. And so what is Planned Parenthood doing to kind of make up for that?
Not only is he saying that he's not going to enforce the law, which no surprise, this is a lawless administration.
Right.
President Trump also pardoned several people who had violated the FACE Act, the federal laws that protect health centers that provide abortion access. So, I mean, that is a really frightening stance that he's taken.
So, many of these provisions in the GOP reconciliation bill are taken right out of the Project 2025 playbook, and that includes defunding Planned Parenthood. Planned Parenthood was always in the target of Project 2025. And so this gets to this whole broader issue of who gets to control healthcare access.
Mm-hmm. Yeah, I think, the Project 2025 was very clear in how a president, now this President Donald Trump, could dismantle the power sources of his political opponents. So, Planned Parenthood and folks who are organizing around reproductive freedom are a huge source of power in this country and of political power in this country. And, these efforts to take funding away, to try to weaken, to try to break apart this movement is at the core of that project.
I have to say that we gave a Forward Award right after Cecile Richards had retired. We got to talk with her about this. She was seeing so much of this in the early Trump administration. So
Cecile Richards is not only, I think, a great leader and hero and organizer and change maker. She really was a mentor for people like Stephen and I, and working with her. She also very much loved Wisconsin and really took every opportunity that she could to come and be on the ground with us here in Wisconsin. She was here for every election. She was here to, help us organize and raise funds. And she is one reason why I am continuing in this fight, because I think if Cecile could spend her whole life fighting, this is what she expects of all of us in her memory. In her memory, she's very missed. Yes.
And one of the things I want to pick up on, here in DC a couple days ago, there was a meeting of the Religious Liberty Commission, so gathering some of the luminaries from Christian nationalism, religious right, together. And one of the things and themes that came out of that would be that Trump is just kind of undoing all the bad stuff that Biden did to get us back to kind of a normal historical precedent place on that. And one thing that definitely perked up my ears was that they said that, oh, just some of the people Trump pardoned were just offering a prayer in front of an abortion clinic and nothing more, just expressing their religious ideas. And so how do you react to that, and how do you as an organization deal with a lot of misinformation out there?
You know, the right-wing movement and President Trump are very, very good at one thing, and that is propaganda. And that is trying to tell a story that doesn't match up with the facts that we can see before our very eyes, with the experiences that we can see and hear and feel. And they try to spin the exact opposite. So it is, the people that he pardoned were charged and convicted of a federal crime. It goes way beyond people who organize and pray for a policy change. These are folks that are terrorizing, stalking,
trying to hinder patients from
trying to
getting in.
block access to what used to be a constitutional right, now only a constitutional right in about half the states. So it is just another example of this gaslighting. I mean, we're seeing it happen in real time right now, where President Trump and his, sycophants are saying LA is burning and sending in federal troops to cause tension instead of alleviate tension. It is every story that comes out of his mouth and that his kind of little chorus around him says is, you should just maybe believe the exact opposite of what they say, because often that is the case, that the facts that we can see and hear on the ground.
It kind of like burns me up when you have these religious Christian, electeds, and they can like embody this type of belief, but it's just so candid when they choose to use it. And so being able to just like see that is just really, really hard and discomforting that, this is where we are. This is the people that are leading the country. And it is most definitely like a lot of misinformation. And it just, unfortunately, is going to come to, it is going to impact, us, the people, the constituents, for all the things that they're doing. And it's just really, really terrible.
And one of the things you talked about during the post-Dobbs era that I want to touch on, and it was that people, in terms of getting medication through the mail or telehealth or things along those lines, one of the areas of concern to FFRF, it would be a potential advancement of the Comstock Act. And do you see that as a threat that could be coming soon?
Yeah, I mean, I think that also was a part of Project 2025,
Yes.
and it is a real threat to access to reproductive health care, specifically to, medication abortion, which has greatly expanded the ability of patients who are in states where they don't have access to a health center to make that decision and terminate a pregnancy. It is.
Well, it's the most popular form, right? Isn't it about 64%
It is.
of abortions are through medication abortion?
And if you think about it, that makes a lot of sense because of where we are in healthcare technology. Most of us would much rather prefer to do a telehealth visit, talk to our provider, and get our medication through the mail. And it's more convenient. It feels more safe to a lot of patients who want to get their health care and be in the privacy of their own home.
And not have to go through a gauntlet of protesters.
Especially
that
if
have been
federal law
unleashed.
is not getting
Right,
enforced
right.
to protect them. Yeah. So it is a wonderful option for many, many patients, and it would be devastating on like the overall impact across the country if patients were unable to get telehealth. And I guess we should also be clear that we actually have a state law in Wisconsin that prevents telehealth for abortion care. So like that is part of, a longer term strategy to get better policy passed here so patients in Wisconsin can also use telehealth for medication abortion. In many other states, they are able to do that,
Yes.
but we are unable at this point in time to do it here.
Good reminder.
Yeah, no, and so that is like a really great segue. And so like for us, we know that, right? And so all the things that we're trying to do is trying to create more access. And so for us, we're working on most definitely taking away the Taliban around abortion. Also the 2-visit minimum. So a lot of people don't know that here in Wisconsin we have to have 2 visits. The second one is very, very much so unnecessary, but it's just like another barrier that they use. And then also we just want to make sure that people are getting the accurate information that they need, and that they're not going through unnecessary procedures that are not beneficial to the patient at all. And in a lot of ways, I would say it's a little bit more maybe like shameful, a little bit more of a thing that plays on people's emotions. But I call that the reproductive. This is a Reproductive Freedom Act, and so that is the policy that we're pushing here in Wisconsin. That we know that will do all the great things for the people that we need to make healthcare even more accessible for folks.
And so one of the things that kind of a through line that's been with our conversation today, whether it's been about Cecile Richards or just being ready to fight back and push back and express what is in stake here, clearly, and just from past history of so many battles. So what is Planned Parenthood doing here in Wisconsin and at the national level to fight back against the bill?
Well, what we're doing is that we're doing a whole host of things, right? And so we're most definitely like getting out and amplifying and bringing awareness to it. I really realize that a lot of people are really not really aware of like all the things that are really in it.
Mm-hmm.
We are taking actions as far as calling your electeds on the federal level, Ron Johnson, and in this like legislative editors, just different actions and whatnot to really galvanize and bring awareness to this. We're also working with our state and local electeds as far as getting their support and seeing how what a scenario would look like as far as getting support and moving forward with being able to be the Planned Parenthood that Wisconsin needs in order to survive and thrive and sustain beyond this moment. So it is a whole host of things, and like always, there is always a seat at the table here at Planned Parenthood. And so if anybody wants to donate or wants to take an action or whatnot, I encourage them to go to Planned Parenthood Wisconsin, and we have the link and get you going on all the great activities that we got going on.
Steve is really being modest because I think his team right now is doing an incredible job in educating the public and getting people to take action. The organizing team has been doing 2 phone banks every week. So people click on the Take Action button on the website. They can get connected to do phone banks. We've done some in partnership with FFRF.
Yes, we are continuing that.
And we had some volunteers of yours at a phone bank last night. I think there have been over 65,000 calls made and, over 600 patched through into Senator Ron Johnson.
Wonderful.
There are events happening all across the state of Wisconsin. I'm sure a lot of folks were out in their local communities for the No Kings rally. Planned Parenthood was there. Our CEO spoke at the Milwaukee No Kings rally. And it just, I think 2 weeks ago, almost no one really knew about the Planned Parenthood piece of this bill. And now with, like Steve said, with coalition partners like you all, and with really pushing the message out, it has made a difference and we're making an impact. Back in 2017, during the first Trump administration, people might remember Speaker Paul Ryan, who is also here from Wisconsin. In the first session of Congress, he said, we are going to repeal the Affordable Care Act and defund Planned Parenthood. So he laid that out. And for the next, 8, 9, 10 months, people activated against that. We spoke out, we targeted Speaker Ryan and other elected officials, and we held them accountable. We protected the Affordable Care Act. We protected Planned Parenthood from getting defunded back then. And we know that when we come together and shine a light on these policies, that the vast majority of people, I don't even know what like the most recent numbers, but like 60, 70% of people support Planned Parenthood being a provider. 60, 70, 80% of people support the Medicaid program. We can stop this bill, and it takes all of our voices, using them together, and calling people like Senator Johnson, like other Republicans who might, not naturally seem like they're going to vote no on this bill. We have to ask them to vote no, and we have to show them that there is power in the people telling them to vote no.
And we should explain that the phone banking can be done from anywhere in the country, remotely.
Yes.
So if you are concerned and you're watching and you're angry, you can hook up with Planned Parenthood of Wisconsin. You can go to FFRFaction.org also to figure out how to sign up to be part of the phone banking. I think might be phone banking going on tonight and into the next couple of weeks. So we'd love to see that volunteerism.
Do not let your experience or your level of activism deter you from letting your power, be heard. And so most definitely, reach out. We case by case, we will train you, we will help you, and we will most definitely make sure that we are successful.
We want to thank both of you, Stephen and Nicole, for coming on today and on this very, very serious threat to Planned Parenthood and what people can do to fight it. So thank you, both of you.
And thank you guys for your partnership.
Yes, very much so. We appreciate it.
We're very proud of it. And that wraps up this week's episode of FFRF's Ask an Atheist. You can also check out our radio show, Free Thought Radio, at ffrf.org/radio, where you can get your podcast too. This week, Dan and I will be interviewing some of FFRF's state legislative team to catch up on wins and losses at the state level for separation of state and church.
And be sure to check out the latest episode of We Dissent, the only podcast hosted exclusively by women constitutional lawyers discussing state-church separation. Listen and subscribe to We Dissent wherever you get your podcast, or check it out online at we-dissent.org.
And finally, if you want more information about the work of the Freedom from Religion Foundation and how you can support us, check out our website at ffrf.org. And if you're a member already, thank you. If not, please join us, and see you next time on FFRF's Ask an Atheist.